All right, there we go.
Okay. What made you want to become an occupational therapist?
I actually had a family friend that their younger sibling received OT services. They had Down syndrome, and he just loved his therapist. He thought she was the greatest person in the world. And I actually went, we'd tag along when he had sessions and things like that, like if we got picked up after school. And I just thought it was really neat. Like, they played with him and they helped him overcome a lot of stuff. He had a lot of social anxiety. And she just was really warm and welcoming and inviting, and I thought it was neat how she interacted with him and helped him kind of be a more functional, independent person. So.
How long have you been working there?
January will be 3 years for me.
Okay.
So, yeah, not very long
Yeah.
now.
What advice would you give to somebody pursuing this profession?
I would say to definitely shadow in different settings. That's one thing. I was really interested in pediatrics initially, but I'm working in a hospital and I love it now. So I think just shadowing it in different areas, seeing if it's something you're really interested in. I'd also do the prerequisite courses that you have to do in school, make sure that you're comfortable with that. And then, I think it's important too to pursue things that you're personally interested in, because that helps you be a better and more well-rounded person, and that's kind of what you're advocating for when you are an occupational therapist. So, anything that you can do that makes you a healthy individual, an active individual, working on meeting other people, because you have to be social, you have to be comfortable talking to others. So anything that you can do to overcome any issues you have with any of those areas. But I think really the number one thing is shadowing areas, seeing if it's something that you're interested in. We have hospital techs here that work with our rehab department, and they, are either interested in the medical field or doing therapy, and so I think that's something that's good to do. We had a girl that worked here, and she now works at a children's therapy location as a rehab aide or a tech too. So I think that's another good thing that you can do, just to see, more in the daily life what it's like too, and it's a good job. So
I really need to shadow. This is the first time I've been
Yes.
in
Yeah, I would definitely, you can shadow hospital. We have outpatient clinics. I would contact some of the pediatric facilities too, because that's the best way to see what a day in the life is really like. So I would definitely do that.
When you graduated and got out into the real world,
Yeah.
Is this job what you expected it to be?
Yes and no. Because of, you go on clinicals or rotations when you're in school, so that was a good learning experience for me. I wasn't interested in the hospital at all. I thought it would be gross and disgusting, and I was like, that's not what I'm into. And then I went on a 12-week, it was a 3-month rotation in a hospital, and I actually really loved it. I got to work with a lot of orthopedic patients, and that was kind of my niche. So because of that training in school, I kind of knew what to expect working. But as an independent practitioner, you have a lot of other demands placed on you, just with scheduling other people. I'm an occupational therapist, so I have occupational therapy assistants that work under me. Learning to work with an interdisciplinary team, so getting along with physical therapists, the OTA, the assistants. That's something that you just kind of have to learn and grow. So I wasn't really, expecting all the responsibility that's placed on you when you are 25 or 26 years old. But being in the hospital setting, it was really great for me, because that was a good learning environment for me. So kind of yes and no. I don't know if that answers your question.
No, that's
okay.
It's more structured, I guess, if you're in a hospital.
Yeah, and it's a better learning environment. Sometimes when you're in a nursing home or in a pediatric setting, you are the only occupational therapist there. And you kind of get sent out on your own. Or if you do a school system, you're just out on your own each day, kind of rotating around to different schools. So for me, it was really good to come here and have that structured environment. But even though you're young and you finish school and all that, you do have a lot of responsibility placed on you, because you're helping care for others and you're trying to make sure that you're a professional adult. So that's something to kind of keep in mind too.
What is your day-to-day schedule like?
I work Monday through Friday. I come in at 7 and I usually leave around 4. You get usually 1 hour lunch break. Sometimes, I write my notes through lunch and leave a little early. But I come in the morning, I check, we have a board upstairs, and I look and see, like we get orders from doctors, so I'll check those, I'll get on the computer, I'll look up the patient's information, I find out, what the doctor exactly wants me to work on, if they have any like weight-bearing restrictions. Sometimes, people aren't allowed to put weight through their leg, or if they had a shoulder surgery, maybe they're not supposed to move it certain ways, so I make sure I know all of that information. And then I usually start seeing patients around 8 in the morning. I typically go around with a physical therapist if we have patients together, and she'll kind of evaluate if they can get up and walk, do they, leg exercises, and then I look at more typically the upper body in the hospital, and then I also help them get dressed. I'll help people take showers sometimes. I try to do all we call it activities of daily living in the morning time, because that's typically what you would do at home too. You get up in the morning, you shower, you get dressed, all that. And then, I'll write my notes, usually right before lunchtime, on all the patients that I saw. And then in the afternoon, we get started again at 1. And I'll typically go back and do like a treatment with the people that I evaluated in the morning. So like this morning, I saw a lot of people that had total knee replacements. I went in, I checked them out with the PT, I helped them get dressed, they got up and walked. And then this afternoon I'll come back and I'll do some education about safety at home. We'll bring them down to the gym and they'll do like a group therapy session with PT, like working on their leg exercises. And then, I'll see any other patients I have. I'll do arm exercises with people a lot in the afternoons. If they need to get up and go to the bathroom, that's a good thing that they practice. And then I sit down again in the afternoon before I go home and write my notes. Typically I spend an hour in the morning doing notes and an hour in the afternoon doing notes.
Okay.
And then the other time's usually filled with patient treatments and things like that. So that's pretty much, typical day. The nice thing about being an OT is you get to pick and choose what you want to do with your patient. So as long as it's within that scope of what the doctor asked you to achieve, you can decide, do I want to do exercises right now? Do I want to help them get dressed? Do I want to take them to the bathroom? That kind of stuff.
That's kind of nice. I didn't know that they gave you the little list before.
Yes, yeah. So you can get orders throughout the day, but when I come in the morning, I kind of know, okay, I have 6 people that I need to get through in the morning, before lunchtime. So it's nice that way. And the doctors always tell you this was a total knee, their weight bearing is tolerated, if there's any restrictions that way. So that helps you stay safe with your patient and know what you're supposed to do.
Oh. I guess you kind of answered this already, but what is it like to work with your patients, and what are they like?
So in the hospital, typically our patient population is like anywhere from 40 to 95. We don't get a lot of younger patients. We'll occasionally get some that are in their 30s, but usually it's, a little bit older. When I work with people that have like an elective surgery, like they choose to have their hip or their knee replaced, they're usually a little more receptive to therapy because they chose to have the surgery. They know that they have to have therapy. They want to get better because they were in so much pain before. So those patients typically, not always, but typically are pretty willing to work with you. We get people that have had falls at home that have to come in and have surgery, and they're not as excited about getting up. So a lot of times you have to work on building rapport with them, encouraging them to participate, explaining the importance of therapy, because a lot of people just want to lay in the bed. You have those challenges that you have to overcome. But I like this job because you see so many different people, you learn about their lives, you can find out what it is that's important for them to get back to. So I think that's a neat thing. And then you pick and choose goals to help them get back to that. We have a lot of people that say, I want to play with my grandkids again, and I can't do that right now, or I want to be able to brush my teeth or get up and walk my dog and that kind of stuff. So
you could do like different exercises for the people who want to play with their grandkids.
Yeah. Yes, yeah, you can kind of pick and choose what you want to do. Some people are shoulder surgeries, and so there's a specific protocol that you follow. But for the most part, everyone's willing to work with you, so that's nice. There's the occasional ones that you're like, okay, you gotta get up now.
Because I thought about that. I wasn't sure what that would.
Yeah, in the hospital it's different. Outpatient, they go there and they know, like they're the ones taking them to therapy, so they know that they have to do it. The hospital, it requires a little bit more encouragement to participate. But once they know you and you kind of get them comfortable with you, they're usually a lot more willing to do whatever it is they need to go home. And I think if they understand this is helping them in the long run, and you do a good job of explaining that, then they're like, oh, okay, I can do this.
Okay.
So,
Yeah, makes sense.
yeah.
Alright. Did it take a lot of adjustment moving from school to here?
Yes. I mean, every day I'm learning new things still. But I mean, especially the first year and even those first couple months, because you're responsible for yourself. And so that's kind of a big thing. And you know, when you're in school, you have an instructor or someone that you're following around that can kind of be like, oh, that's a good idea, or maybe you should modify this, because they're teaching you. So then when you get out, you're like, okay, what am I supposed to do with this person? But that's what, like I kind of talked about earlier, being in this setting really helped me because I had physical therapists that had a lot of experience that I would go with, and they'd be like, oh, well, maybe you should check this out, or, you know, maybe you should work on this. And there was, I guess, like I had a mentor here too that had been here longer than me when I came on.
That would make me feel a lot better.
Yeah.
If I had somebody that
That's,
knew.
I would encourage anyone that's going to graduate and come into this field to go to a setting that has people with experience or that are willing to kind of mentor you and help you along the way, because you just, I think you're a better practitioner, you're a lot safer with your patients, and you learn so much more if you can do it that way.
Okay. I'll have to do that.
Yeah.
When you first started, what were your hours like? Were they like they are?
Yeah, they're the same. Yep. I kind of chose when I came in here. I said I wanted to work 7 to 4 because I get up early anyways, and I'd rather be off at 4. We have another one, Jessica, that works here. She comes in closer to 8 and leaves, you know, about 5. So depending on your setting, you can kind of pick and choose what your hours are. But yeah, I've done 7 to 4 pretty much since the beginning.
Okay. And do you see yourself staying in this career until you retire?
Yes, definitely. And that's the best thing that I think about any therapy field, whether it's, you know, speech or PT or OT. You take your test, you get licensed. You know, I chose that I wanted to work in acute care now, but if I think that I want to transition to outpatient eventually, I can do that. You know, I want to make sure that I'm like competent in the area and that I know what I'm doing, but there's no extra special tests or licensure or anything like that that you have to do to change. So I think it's a good field to get into for longevity wise, because I can switch different settings throughout the day. And
That's kind of what I thought.
Yeah, I go to a nursing home 1 day a week now, and I see patients, because for my company we have different facilities that we work at. So I'm here usually, but on Mondays I go to a nursing home. We have, it's called St. Bernard's Villa, with people that have dementia, and it's also like an assisted living facility. Like we have some occupational therapists out there. If I was interested in outpatient, I could transition to that. I mean, it's a good area to get into. If you wanted to teach eventually, you could, you know, teach and do academic things. So I don't see any reason that I would not be an OT, and that was part of the reason that I picked this field.
Okay.
You have areas of advancement and growth pretty much throughout your career. So,
That's one of the reasons I was interested.
yeah. No, I mean, I love my job. Like I can't see myself wanting to get out of it for any reason anytime soon. So.
Okay. And what is your favorite part about being an occupational therapist?
I like meeting different people daily. You know, you see all kinds of people. I really enjoy that. I like to, you know, learn their stories and know kind of what motivates them. I think the best thing though is just that you're helping each person that you see get back to whatever is important to them. And I think that's kind of empowering, and it's good because I know at the end of each day that I help someone's life, you know, make it a little bit better. So that's just a nice feeling, whether it's something small like, hey, they can put their pants on now, but they couldn't do that before.
I mean, I wouldn't be able to do that.
Yeah,
Awesome.
and so it's a good way to know like you're doing something positive each day. Whereas, you know, I'm not the type of person that would be happy doing a desk job and sitting around all the time. I like to be up and active and going. So I just enjoy the variety in that, you know, it's goal oriented. I can check something off and know that I completed this and that we're on to the next thing each day.
I'm the same way. I always have a
Checklist,
Yeah,
yes,
all
okay.
over-
You're
all
going to
over
be a
my
good
planner.
OT, yeah, because
Yeah.
that's how I am. I like to know, like, this is next and this is next. I think any therapist is like that. So
Okay.
that's definitely a good indicator
That's
for
good
you.
because,
Yeah.
I have a whole bunch of check marks because right before Thanksgiving and there's a lot of projects.
Yes.
Yeah.
Yeah. No, that's, I mean, I think anyone, they're goal oriented, they like to know that they're working on this progression of things. So that's a good indicator that you probably enjoy therapy, I think.
Okay.
So, any other questions?
That's it.
That's it. Okay, that wasn't too bad then.
Okay, yeah, thank you. I
No
really
problem.
appreciate it.
Yeah. So, you're a freshman, you said you're exercise science right
Yes.
now? And then so you're just trying to get your prereqs
Mhm.
and then figure out, okay. Well, yeah, if you ever want to come shadow or something, you got my number now. You can
Yes, I do.
call or
Send me a
text me.
call.
Yeah, and I mean, you can always check with our outpatient facilities too, because I think that's a good way to know if you're really interested in it. And I would definitely check pediatrics or any other type of setting that you think you'd like to.
Okay.
Yeah.
Thank you.
No problem. Is there anything else you need, or
I think we're
that
good.
was it? Okay,
Yeah.
good deal.